evening and happy Valentine's Day, and welcome to Korman Plastic Surgery. I'm plastic surgeon Josh Korman, and I would like to welcome all of you to our evening program on breast surgery. There are a lot of new things and exciting things, and I would encourage all of you to stay until the end because we'll have a Q&A where I will personally answer all your questions, and also anybody who stays to the end gets registered automatically for our raffle. But besides that, we have a lot of special savings for all of you and a lot of good information, and I look forward to talking to you. This evening we're going to talk about several different breast options. We're going to talk about breast augmentation. That's for increasing volume, and that can be both with implants or with fat transfer. And we have some very special new implants which are really changing the whole shape of the market. So we have the implants or we have the fat transfer. Then for many women who need some amount of a lift, with or without volume, we'll be talking about the different options for breast lifts the medical word is mastopexy. And then for people whose breasts are larger than they would like to be or too heavy for them, we'll be talking about breast reduction. And we also have some additional techniques that really help with some skin tightening, but minimally invasive, with technology called Renuvion. So we have things that are new, Motiva implants, Renuvion. So all these things are new in the breast horizon, and we're happy to share them with you today. So let's talk about breast volume. It's easy to think, oh, just take fat from my body because it's my own stuff and then just stick it in the breast. But the thing is, it's not like you have a closet full of fat that whenever you need it, you can pull on it and put it wherever you want, and whatever you're going to take out is going to stay, and it's going to be the same, and it's going to make it soft and all that. It doesn't quite work that way. Many people that want fat don't actually have enough fat. Plus, there's the whole question of when you take the fat out, what happens to the skin? The way I like to think about it is, if you're really mostly interested in liposuction, and oh, by the way, if the fat that's coming out, instead of throwing it away, maybe I can put it in my breast, that is a totally logical way to think about it. If you are thinking more, I'm trying to increase my breast volume, in my experience of many years, implants are a much more reliable way to achieve what you want. It's not that you can't achieve it in certain cases, but with fat, but it is different when you put fat in the face, it's different than fat in the breast. So there are many, many choices for implants, and it's good. I'm happy to talk to anybody about whether you should use fat, because I've done it many, many times, or implants. But there's certain things that you're trying to accomplish when you're doing increasing breast volume and things in the breast. One is the superior pull fullness. It's when we're young, we have more volume at the top part of our breast. As we get older, gravity and loss of breast tissue, and also breastfeeding and all those other things that happen in life, we tend to lose the superior pull fullness. And breast implants are generally a much better way to give you superior pull fullness. Also, implants are more reliable in amount of volume and where they'll stay. And there's lots of ways to put implants above the muscle, below the muscle, and incision locations around the nipple, under the breast, under the arm. I've done thousands of these in all these different directions, and I'm very happy to accommodate whatever your personal requests are in line with what works for you as a patient, that it's safe and reliable and beautiful. So I want to show you the different implants we have. There's saline implants, which is essentially a water balloon. This is a saline implant without water in it. Advantages: if it breaks, in the very unlikely case it breaks, then you know right away because it would deflate. Downsides is that there tends to be more chance of rippling, and if they're a little heavier than silicone implants. Then we have silicone implants, where they are come in several, they're all round, but they come in several levels of profile, how far they come out and width, and that's part of the process of measuring your basic breast size, because we want you to have really good cleavage but not too much width. You don't want to feel fat when you walk. So how does it sit? So there's different ways that they can be lower profile and higher profile. You see this is higher. And then the newest implants that I'm very proud to show you are called Makita implants. And these are different in that the silicone is different and the shell is different. They have a different kind of safety profile, and they have been around in other countries for 14 years. They're in the United States, they're fairly recent to the market, and I'm very excited to be having the ability to provide these to my patients. So there are many choices for breast volume, and the future is really yours. So now let's talk about lift. And it's really not so much lift as it is position, breast position. And breast position, as I'm sure you all know, changes over time. And how we relate to it and what we do about it is important, like in everything else in medicine, to diagnose before you treat. So first, let me show you a diagram here of what breast ptosis, meaning breast droop, happens. So this is, and I realize that different ethnicities are a little bit different, but in general, this is normal. And then grade 1 when it's a little bit down, grade 2 when it's lower, but the nipple is still not pointing down. Grade 3, the nipple is pointing down. And then there's something called pseudotosis, where the nipple seems like it's in correct position, but the breast sags below. And then there's what's called, it's a big word, parenchymal maldistribution, basically when the tissue has all come down. It used to be up here and now it has come down. So there are a lot of different ways and techniques to get the breast to look and to be where it used to be or where it should have been. And I use a lot of different techniques to do it. I am much more a non-algorithmic based breast surgeon. I do it till it looks beautiful. And some of it is measuring, but a lot of it is from experience, what looks right, moving tissue, because what happens to the skin and the underlying tissue, they don't all go together. And so you need to keep thinking in 3 dimensions to craft a beautiful breast. And so I use techniques of taking out skin. I always try to do the least amount of incisions that are going to, so they'll end up with the least amount of scarring. One particularly strong opinion I have is that I don't think it's good to create a scar that goes too far to the center or too far out to the side. Because if it goes too far to the center, which is often done when you do an anchor type incision, where an anchor, if you think of the circle at the top and then down and the anchor, if the middle part of the anchor goes too much to the center, then if you're wearing low cut clothing, I don't want anyone not to be able to wear the clothing they want because of the scar. So I don't do it that way. I do it as minimally as possible so that you can choose whatever clothing you want. Similarly, I think it's important not to make the incision too far to the outside, because I want every woman to be able to wear a tank top if they want to, or a skinny bathing suit, whatever they want. And so I work really hard also to make the incision very short. Now, in breast augmentation, the incisions are very, very short, like this small. In mastopexy, then you need a longer incision. Now, a lot of women are very concerned about that they don't want cuts in weird places. So I just wanted to assure you that the whole idea is that that you can have an incision that's around the areola, and that actually looks very invisible in many cases. Then if you need a vertical incision between the bottom of the areola and the bottom of the breast, that you actually only see if you're pulling up your breast. Many procedures you can go to Google University or ChatGPT to really learn what to do. With breast surgery, you actually can't. You need to come to somebody who's had a lot of experience to help guide you of what's the right thing for you. So whether it's volume with fat or volume with an implant, a lift either with a non-invasive technology such as Renuvion or minimally invasive, or surgical, and what kind of lift, what kind of incisions, what kind of combinations with implants or a lift with fat or implants. All these many different combinations are things that are not one size fits all, and it is really hard, even with sending pictures, to kind of figure out what's best for you. That's why I'm here to help you, to help guide you, to really figure out what is the best for you. And a lot of times, whether somebody needs a lift or doesn't need a lift, I often take my fingers and bring the two edges of the breast together to see if my fingers meet. And I can't do that virtually, and I can't do that online. I can only do that in person. And that's why I encourage all of you, or any of you, to learn and be educated, because it's so important to be an educated consumer. Lots of people want to know, what's the recovery from this operation? Well, it kind of depends on what you're doing, but in general, it's a pretty fast recovery. I sometimes say, if you really want to know it's about a week. And what does that mean? Well, you can go back to work in about a week. Can you go back sooner? Often you can. It all depends what you're going to do. Going back to your Pilates classes and gym class, that's more like 3 weeks till you can start doing some exercises, and you really don't want to engage your pectoral muscle until about 6 weeks after surgery. And the general recovery, I give patients usually a non-narcotic type of medicine to take a couple days before, like an anti-inflammatory that doesn't make you bleed, so that then you don't need so much pain medicine, although I do prescribe some pain medicine if you need it. You have a supportive bra for the recovery, and in general, just think that your elbow's attached to your side, so if you need something, you go towards wherever you're going, and you don't want to bend over too much in the few days after surgery. It's generally an easy recovery, and something that I always try to under-promise and over-deliver. And so when I tell you it's about a recovery for a week, be able to go back to work, I think that's a good estimate.
Thank you everyone so much for staying on, attending tonight. Please remember to stay till the very end. Each of you will receive a text message. If you'd like to learn more, schedule a consultation, just reply back with the text message and I will reach out to you in the days to come. We are also doing a live Q&A with Dr. Korman here next, so type your messages in the chat box. They are anonymous, so don't be shy. We'll read them out. We'll try to get through everything, and Dr. Korman himself will be responding. And then last but not least, you will also be receiving a text if you are a raffle winner. So keep an eye out for that as well in the days to come. Thank you so much. Good evening, everyone. Thank you so much for joining us on this soon-to-be stormy night. So appreciate it, and we're getting some questions kind of coming in, so please go ahead, type your questions. We'll try to get through everything. If for any reason we don't answer your question, we can follow up with you one-on-one afterwards. So one question I'm seeing here is, Dr. Korman, do you use drains in any of your breast procedures?
I would say almost never. For breast augmentation, I don't. For breast lifts, again, almost never. So I think the short answer is no.
And then we have one, so which implant do you recommend? And the kind of follow-up question to that is, how often do they need to be replaced?
So which implant? I would say the right one. So what does that really mean? Some people want saline implants. Some people want something called a serene implant, which is basically a saline implant with extra shells to make it feel more like silicone. I personally think that silicone implants feel more like a breast. So in general, I think that's probably the better way to go, but it's really very much patient dependent. And in terms of which company, I think I really feel like it almost doesn't matter. Although I think that the new Motiva implants are a little bit shaking up the industry. So we'll all kind of learn as it goes. But I think in general, it's really more about how they're placed and the right size rather than what is exactly which company. In terms of silicone versus saline, it is definitely patient dependent, but in general, I usually recommend silicone gel. In my experience, many women have switched from saline to silicone, but I've actually never seen a silicone to saline switch.
And how long do you think, until you have to replace the implants?
So implants are, they last, silicone is an inert substance that lasts 40 million years. So in general, I would say the things that really make a difference is meaning if you have implants before you have children, then when you have children, your breasts get bigger, your breasts get smaller, your breasts go up, they go down. That's often how it happens. If you lose a lot of weight or gain a lot of weight or more than one of those things, then you might need to. But in general, I think that sometimes you get some scar tissue, which is called capsular contracture, which we try to make as low rate as possible. Sometimes we'll switch an implant for that, or in the very unusual case, if it breaks, in which case, then we'll switch it. So I would say, in general, it's more about what happens in your own lifestyle. And then other than that, it's the few situations I mentioned.
And then great question is, do I need to reach a certain weight or be at a certain fitness level before a breast procedure?
Well, I think it depends what the breast procedure you're looking for is. If the right procedure for you is a breast augmentation, no, that's probably not, that's good where you have it. And if you're looking for a breast lift or a lift with an implant, things like that, in general, you should be at a stable weight. I think you don't, if you're on many people are on these different weight loss protocols and weight loss medications. And so if you are on the descent and losing weight, then you should be at a point where you're at a stable weight. Breasts are they're composed of breast tissue and fat. And some women, it's almost all breast tissue, meaning it does not change with your weight going up and down. And other people have most of it being fat, so it will change. So the point is you want to be at a steady weight. And that's again why it's really helpful to seek a professional opinion, because they can give you a better answer than you just trying to figure out yourself.
And are there any other requirements before surgery? Not too sure specifically which operation it's referring to, but I guess in general, what should people do or not do before a breast operation?
So first of all, mammograms in women over 40 or 50, and often depends on what kind of family history you might have. Those are the kind of things that do play into this about deciding, but mammograms, or to be up to date with your mammograms. Aside from that, what to do before, after, it's to do it before. There really isn't much requirements of what to do to prepare yourself for it, except to be an educated consumer and to work with me or with a practitioner on what is the best size for you.
And do you feel that there is a age range that breast surgery cannot be performed?
So I think in general, girls, when they're growing and they haven't reached maturity, I think it's not a good idea to put implants in before they stop growing. And on the other side of the scale, there, you don't want to put very large implants in anybody who has back problems. But I've put implants in some, what some people might think are too old, like 70 years old or 75 years old. But usually it's in the range of about 20 to 60.
And does that apply for reductions and breast lifts as well?
So I think the most important thing is to be healthy, because you don't want to do surgery unless you're healthy. And if you're healthy, I think breast reductions, I guess, yes, I would say, there's always exceptions to everything, but I would still say that's about the range. You do not want to operate on somebody who hasn't finished growing, and you don't want to operate on somebody who's not healthy, or somebody that really has things that are bother them in a way that, such as histories of breast cancer that's quite significant in their family. This is where you want to, it's not that it's no, but you want to be careful, and you want to be methodical about making sure that everybody understands what's happening.
And then we have a question here actually about fat transfer. So can liposuction be done on the bra roll? And can you do fat transfer with that fat? And the part 2 to that is, can you do fat transfer as well as implants?
The answer to both questions is yes. You can take it from the bra roll and put it into the breast, and you can put an implant in and add fat also. It's a little bit of a question in which case scenarios would work the best, but yes, there's no reason you can't do both of those things.
Perfect. And just to interject for everyone, I'm sure you saw a poll pop up on your screen, so you can click that. You'll also receive a text at the end of the event, so be sure to reply Korman to that text, and then we will be able to contact you to schedule a consultation. So I interrupt this important conversation to remind you to look out for a text at the end of our webinar. So we have one. So do you do breast reductions for men?
Yes. Breast reduction for men, otherwise known as gynecomastia, I do very often. And it's a question of what level of excess breast tissue there is, or fat, or both. So for many situations, you can do a very small incision and do liposuction, and then through a very small incision in the areola, you cut out the breast tissue. So that certainly works. For men who have lost a lot of weight and still have a lot of fat, then it's a little more like a breast lift in women, but it's obviously not the same type of incisions. So the short answer is yes, breast tissue happens in women and men, and larger breasts than desired happens in both men and women, and I do both.
And then where do you perform your surgeries?
So part of my office in Mountain View, the surgical offices in Mountain View, is our Hospital Drive Surgery Center, which is part of the same building. It's a fully accredited surgery center that I built about 20 years ago, and it is a staff. The anesthesiologists come from the El Camino Hospital Anesthesia Medical Group, and I'm proud to say that we achieve the highest level of accreditation. We're Medicare certified by the Centers for Medicare and Medicaid, and we aim to not just have a safe experience for patients, but a very good and warm experience. So people, obviously, surgery can be anxiety provoking for all of us. But the idea is it's like the Cheers bar where everybody knows your name.
And then we have one question. So it's always kind of a hot topic, and I think something we hear often in the office sometimes when people are deciding between implant and fat transfer. But Dr. Korman, maybe share your thoughts a little bit on maybe breast implant illness in that regard. And then I think also we can talk a little bit about patients who have experienced BII and what their options are if they are suffering from such symptoms.
Yeah. So breast implant illness is a thing. It's a real thing. The Food and Drug Administration recognizes it as a real entity. And I think who it might happen to, or to what level and what type of severity, that is a little bit unclear. In my experience of that, there's many situations which are not clear. So what that means is that if women have symptoms, whether it's fibromyalgia or chronic fatigue, for example, those are generally diagnoses of exclusion, meaning you can't, real symptoms, but they are not attributable to something else. So sometimes people get the diagnosis are given chronic fatigue, for example. Well, breast implant illness, I think, is a real thing. How prevalent is it's fairly rare, but it is something. And I think the important thing to understand is that, millions of women have breast implants, and the number of people that have what's perceived as breast implant illness is obviously a very, very small fraction of that. I think the point is that it is a little not so clear about what causes it, although most likely it's some version of the implant. And I think it's important, like anything, to weigh the risk versus the safety profile of implants and to understand what to do about it. The good thing generally about breast implant illness is that if there is a treatment for it, which is to remove the implant and the natural capsule that forms around it. So it is not like there isn't a treatment for it. So anyway, I think there's a whole, you could talk for a long time about breast implant illness, but I think the point is, it is, in my opinion, it's pretty rare and good to know about. And just like anything else, good to know the safety and risk profile of any operation you're going to do.
Mm-hmm. Mm-hmm. And then if someone decides to do more the fat transfer route versus implants, how much of the transferred fat is actually retained after 6, 9, 12 months?
Mm-hmm. Well, I think how much is retained, the sort of conventional wisdom is that what you should think of is it's about 50% is retained. I would say it's very much dependent on the basic amount of fat that the patient has. That someone who has a BMI which is basically the calculation of how much fat you have. If it's low, like if someone has really very little fat to begin with, there is more chance that less than 50% will be retained. Whereas somebody who has more fat on their body to start with will have more chance that they will have more retained. So I think it's really a question of the profile of the patient. But the 3, 6, 9, 12 months, I think I would say the ultimate number is about 50%. And I would say the 3, 6, 9, 12 months, I think it depends. So I don't think there's a clear answer with the actual 3, 6, 9, 12.
And then another fat transfer question. So we had before a lot of back lipo questions coming in. So absolutely can do back liposuction. But what happens to the loose skin there?
What happens to the what?
To the loose skin if you do back liposuction.
Right. So that's why I actually like not just the liposuction, but these two other techniques that I use a lot, which is Vaser. Sounds like laser, but it's Vaser. It's internal ultrasound. And then also Renuvion, used to be called J-Plasma. I do think that the combination of those, and especially the Renuvion for the skin tightening, really does help the tightening of the skin in the back and other places too, but specifically in the back.
And does extreme weather impact the implants at all?
No, I don't think so.
Perfect. And then just kind of going through some redundant questions, I guess, how long will results last? It's not tied to a specific procedure. So I guess we can generalize. How about a lift versus augmentation? How long do results last?
So I think this is where something about where you put the implants. If you put the implant under the muscle, I think it's a little bit anti-gravity. And if you have put a very large implant, I mean, gravity is the biggest force on the planet. So I think it depends on the quality of your skin, whether it's been stretched through multiple children, or whether you have a lot of stretch marks because a lot of weight loss. I think those are the kind of things that affect how long it lasts. I think it's also it's none of it is a license to go braless endlessly, but having implants under the muscle is, in my opinion, somewhat more anti-gravity than going over the muscle. And I think also it's related to a patient's own looseness of skin.
Wonderful. Well, kind of wrapping up, it looks like we've answered most of the questions that I can see. There might be a few more here, but we can follow up with everyone offline too. So just want to remind everyone who's joined us or watching this that this Valentine's Day, we're offering $2,500 off of our breast procedures. So if you want to learn more, schedule a consultation, get any more kind of tailored information for your specific case, go ahead, just text the keyword Korman when you receive the text after this webinar is done. And then we will reach out to you. We'll also be reaching out as everyone's entered into a raffle. So have some really cool, fun, exciting giveaways too.
And I'd like to thank all of you for joining. And if there are any questions I can answer to any of you, please feel free to reach out. My email is joshkorman@gmail.com. And I'm pretty good at responding.
Wonderful. Well, thank you so much, everyone. Really appreciate you joining us, and we will see you soon.